Thanks so much for the invitation to be here today, and thanks to my colleagues, both Jesse and John, for wonderful comments about how your journey began and how it has led you into being what you are today. So, as Dick said, I am the CEO of Children's Hospital of Wisconsin, and if you asked me if I was ever going to be that when I was in nursing school at Marquette University, I would have said, "Are you kidding me?" No, that would never happen, but it's an honor and a privilege to be able to lead such an extraordinary organization. And as Dick mentioned, our vision for our organization is that we do want the kids of Wisconsin to be the healthiest in the nation. And if you look at where kids are in the state of Wisconsin, you soon find out that we've got some of the worst health outcomes in this country. We're the fourth worst in the country, and many outcomes for kids in the central city of Milwaukee. So we've got a lot of work to do, and when we think about kids, we think about them beyond just the medical needs. And I'll talk about some parts of our organization that explain how we're able to really aspirationally drive towards this journey to have these healthy kids. So I want to start out with a quote from Dr. Martin Luther King that I really feel is core to servant leadership, and it was in one of his sermons over 50 years ago. Everybody can be great, everybody, because everybody can serve. You don't have to have a college degree. You don't have to make your subject and your verb agree. You don't have to know Plato and Aristotle. You don't have to know Einstein's theory of relativity. You don't have to know the second theory of thermodynamics and physics. You only need a heart full of grace and a soul generated by love. And that's the essence, in my opinion, about servant leadership. So I'll tell you a little bit about my story. I was actually born in northern Illinois, just the other side of Wisconsin. My grandfather was the first physician to ever move to our town at the turn of the last century. And he's established a practice in a small community where the town doctor in those days was the town mentor and coach and many things to the people of the community. And my father followed in his footsteps, and so he became the town doctor on the heels of my grandfather. And as a Catholic family and a Catholic town with a Catholic education, my parents always drove us, all six of us, or six kids, towards just doing good things. And so I came to servant leadership by observation, mentorship, and coaching. I can't tell you when I started to formalize my opinion about what that really meant, because I really just had it through experientially through my entire life, my entire career. But it really did start with my dad, and I can remember that, yeah, he went to the office 7 days a week, and even on Sundays after church, and it wasn't uncommon for us to be at home on a Sunday afternoon and a sunny day and somebody coming over to the house because a fish hook got caught in their finger. He was just that kind of guy that it didn't matter. Yes, he had office hours, but many times I'd go with him after his office hours, and we'd go to people's homes, and he'd make house calls. And sometimes people couldn't afford to pay, so we'd get cakes and chickens and all sorts of different things. But he never cared, because he was really understood that he was there in a very humble and humbling way to serve people. And so 4 of his 6 kids are nurses, interestingly enough. We went to nursing school. We've all done something a little bit different. But as I was learning about what I wanted to do in my profession, truthfully, I was scared to death of my pediatric rotation. I thought, oh my gosh, I don't know how I'm ever going to be able to do this. And I had a fabulous mentor in a nursing coach that was my instructor, who taught me the essence of what it really meant to take care of kids. Because, you know, when kids come to the hospital, they come with families. Nobody wants to have a sick child. Nobody wakes up in the morning and wants to bring their child to the hospital. But they find themselves coming to us oftentimes in crisis, very vulnerable situations. They're worried, they're scared. And so it's our obligation as a children's hospital to make sure that we can wrap ourselves around those families and make sure that that entire family gets everything they need, whether they're coming for heart surgery or neonatal intensive care or whatever it happens to be. And yes, John, I know what it means to not have the pneumatic tube system, and I can tell you, you can't serve the patients well, so thanks for what you do with that, what you do with that. A little bit about Children's Hospital, because I think this really speaks about servant leadership and why my colleagues, how we work to make that experience for the families the very best. So we actually got our start in 1894. There were 7 sisters, women, who knew that children needed something a little bit different than an adult system of care. And so they started the Children's Hospital over on Brady Street with 4 beds in this little ward room. And that vision, that dream, that forward thought built us into being now today one of the most notable children's hospitals in the country and the world, and some of our outcomes in kids with heart surgery and cancer rival anywhere else. And so we do get kids from all over in order to do that. But in 1892, there was another organization in town called Children's Service Society, and it actually started with a minister with a horse and a cart and went around town and picked up orphans on the street. And so that grew into this amazing foster care and adoption agency that now is part of Children's Hospital, where we do foster care case management for 3,000 kids. John, you'll understand the importance of all that, and do adoptions, etc. So we look at kids, when you think about the vision of we want the kids of Wisconsin to be the healthiest in the nation, we know there's so many other factors that actually drive health and drive health outcomes beyond just great medical care. So in our lens, we talk about that, and the care you receive only counts for about 20% of your health outcome. That's amazing to me. I was like, oh, no, we really count for so much more. Well, no, it's your genetics, it's where you live, and the choices you make. And we know that unless we can holistically wrap ourselves around these kids and help them develop resiliency and become successful in their lives, we can't ignore these other factors that are influencing them, like housing and crime, several other aspects of lack of food, not having good schools. And so, yes, we want to give them the very best medical care, but we also want to make sure that the environments that they're growing up in is holistic, it's important, it wraps around them in these very important ways. And I got to tell you, as a children's hospital, that, again, we can brag about a lot of factors of where we get, national and international recognition for, our care, our education, our research, our advocacy. We also know that we've got to look beyond just the walls of what we do every day and make sure that we can take care of them. The number one reason kids miss school? Toothaches, dental pain. So we have dentists because we know that the best thing for kids is to be in school and learning and to make sure that that need is met. The other area that we're working on right now is mental health, because we have about 2/3 of the kids in the central city of Milwaukee have chronic unresolved mental health issues. Well, you all know that if you're growing up with anxiety, depression, all these other things, it leads to juvenile justice, it leads to opioid addiction and these things that face kids today. So again, it's really taking a community of caring and making sure that we can do everything we can to help these kids. And to me, that's the essence of servant leadership. It's really, I love the idea of listening because we need to listen to understand what people really need. We don't do this alone, and one of the other just treasures of Children's Hospital is our workforce. And wherever you work in our organization, all of our 5,400 people are incredibly valuable and important. And John, you're right. Whether you're working the pneumatic tube system or you're cleaning the hospital floors or you're in the OR passing instruments to the doctors, you do matter. One of the programs that we've adopted at Children's and we have woven into the fabric of everything we do is a program called At Our Best. And At Our Best is a philosophy, it's a framework, it's a way that we need to show up every day going to work. So it's very values driven, it's very intentionally about serving. It's not about you. It's about how you can show up and be at your best. We talk a lot about our investments in employees because I always like to say the patient experience can never exceed the employee's experience. So if you don't have a great workforce that you're investing in, no matter where they work around the organization, you're not going to be able to have the product. Yes, you'll technically get done the work that you need to get done, but you will not be able to really have people be there every single day. And again, when you think about the kids that come through our doors, people need our love and kindness. They need our caringness. They need us to advocate for them. And so this program is really, it's no longer a program. It's just the way we do things. One of the driving values we talk about constantly is purpose. We're here to serve the best interest of children and their families. It's not to serve ourselves. And so I love the idea of listening that you spoke about, because listening for understanding is one of the major drivers in our value of purpose. So it's a wonderful organization. I can tell you that I'm so honored, and it's just a great privilege. I am so thankful that I've had the opportunity to be in an organization like Children's, to lead an organization like Children's, so that we continuously and constantly do everything that we need to do to drive for those great health outcomes for kids. So my advice to all of you is keep your passion at the center of all you do. And like Dr. King stated, have hearts full of grace and a soul full of love. And thank you so much for your time.